Today, we remember Dawson's Creek star James Van Der Beek, who passed away on Wednesday at just 48 years old, dying after a fight with colorectal cancer, the second leading cause of cancer death in America. Join us now for more is a doctor at Ohio State University, Wexner Medical Center, Dr. Peter Stanich. Doctor, great to have you. A lot of people talking about this today, and particularly since James passed away. But colorectal cancer, it's on the rise among people under the age of 50. Van Der Beek was 48 years old at the time of diagnosis. Why are we seeing such an increase in this cancer in younger people?
That's a great question. We don't know the exact answer to that. Certainly, some of it is lifestyle factors. We know obesity is increasing in the United States, including in young people. We know that more sedentary lifestyles and less activity is an issue, and that's changing. And diet has changed, and the way we eat in the United States and other places has changed. So we think all those are playing a role. Now, it's unlikely that any one of those is the main driver. Likely, it seems to be a combination of factors, including things that we're not aware of yet, but lots of people are working on it to try and reverse that.
So Van Der Beek was a big advocate for people to get screened early on for this. Can someone ask their doctor, for a colorectal screening if they do not have any symptoms and are under the recommended age of 45?
So that's a good question. I think it's a good thing to talk to your physician about or your healthcare provider. The guidelines do recommend if you're average risk, so if you don't have a family history of colon cancer and don't have a personal history of colon cancer or colon polyps, that you should start at age 45. But that is something that can be discussed. Certainly, if any symptoms come up, things like rectal bleeding, change in bowel habits, iron deficiency anemia or low blood count due to low iron levels, which can be from bleeding in the GI tract, and abdominal pain. If you have symptoms, then that certainly needs to be looked into, no matter what your age is.
Got it. And what are some of the warning signs and just risk factors of colorectal cancer?
Great question. I think the major risk factor is a family history. So hopefully everyone's talking to their family, finding out if parents, aunts or uncles, siblings have had colon polyps or colon cancer. If a close relative, like a parent or a sibling, has had a colon cancer or what we call advanced adenomas or like a large colon polyp, you would likely qualify for early screening. And we know if we do colonoscopy early in high-risk people, we can hopefully prevent colon cancer for them. And then in addition, as we talked about, there are other risk factors, things like inflammatory bowel disease, other GI conditions can increase that risk, as well as genetic factors.
It's always good to talk about these things. They're not always comfortable, but in a time like this, it is important just to reiterate the importance of getting checked and what to pay attention to. Dr. Peter Stanich, appreciate your time.
Okay, I appreciate it. Thank you for having me.